All right, so welcome to our open enrollment benefit education session. We have some great material to go over today. We have a lot of it. So please make sure to use the chat box for any questions. And please make sure to keep your microphones on mute at all times. We would prefer to ask questions over the chat box as this is being recorded. We will have Rob Bruner or Larry Valtenson calling in as well to go over our retirement information. We have Lori Murphy from Wells Fargo Insurance who will be doing a majority of the presentation. And I am Lisa Panasco. I'm your benefits analyst. I will be going over several of the slides as well. So Lori, I will go ahead and I will kick that off over to you.
Great. Thank you, Lisa. I apologize, everyone, for my ineptness at this getting set up here. I didn't have any trouble earlier, so I was anticipating no problems now. But so we are going to be covering a lot of information, and I probably will be talking a little bit fast, so I apologize about that. Obviously, we're going to cover the 2017 plan year changes for your health and welfare benefits plans, in addition to providing an overview. And then we've got a little bit of information about healthcare reform that we'll do some review on. Lisa will talk about corporate athlete, and then in addition, some employee benefits and perks that you might be unaware of, and then what your action steps for open enrollment will be for 2017. So for 2017, what's staying as is your medical plan will stay with CareFirst. Your dental plan will stay with Delta Dental. Your vision stays with VSP. Life and disability and your FMLA administrator will be Cigna. That does not change. We'll continue to offer the Legal Shield and pet insurance on a voluntary basis. But things that are changing is your traditional PPO plan will have a change in the copays for the office visit and prescription, and then the employee premiums will change. The high deductible plan, while the benefits are not changing, there will be a decrease in the employee premiums. The health savings account does change from the Wells Fargo administrator to Optum Health. And then the single maximum that IRS allows for a health savings account is increasing a bit. And then dental plan premiums are going to increase. So benefit eligibility is kind of where we start off first, and obviously full-time employees working 30 or more hours are benefit eligible. The dependents include spouse, domestic partner, and then children to the age of 26 for the group health plan, and you do need to look at each plan to make sure dependent children to age 26 are covered. And then also domestic partners are covered, and there are some tax implications because they're a non-taxable dependent, so you'll need to check with HR in regard to those rules. And then during the year, you can make changes if you've got a qualifying event. You can add a spouse if you get married, or remove a spouse, ex-spouse if you get divorced, birth of a child, adoption, loss of outside coverage. That is a qualifying event that would allow you to get on the plan, and then gaining coverage through, let's say, a new spouse. So your medical plan, we're going to talk about just a few key terms before we get underway here. We'll make it a little bit easier for you. Deductible and embedded deductible, two different terms that we've got. So deductible, it seems like a pretty simple term to me just because I do this all the time, but not necessarily for you because, you have your own lingo for whatever job that you happen to have. But deductible for your health plan is on a calendar year basis. So an example of $500 deductible, meaning that you would have to incur $500 worth of covered expenses and pay that before your plan pays out. And it is a calendar. Most people understand car insurance, and when you get into auto accident, you have a deductible. You're going to pay, for example, if you have a $500 deductible plan for an accident, you're going to pay the first $500, and then your insurance is going to pick up the rest. That is a per occurrence. On the health plan, it's a calendar year accumulation, so anything that's incurred in the same calendar year. An embedded deductible is really a term used for family coverage, and what it means is that you've got two components to your deductible when you've got family. You've got the individual deductible and you've got a family deductible. Having two components within a family deductible or family plan allows for each person in the family um, to have an individual deductible. And so your plan operates on an embedded deductible. And on the high deductible plan, this comes up just because of some of the IRS regulations. So it is in your favor that we do have an embedded deductible set up, meaning it's a per person deductible for the high deductible health plan. Additional terms, copay is one that most people are familiar with. Basically, you pay $25 or $20 when you go to an office visit, and then you don't see a bill. That would be a copay. So you pay an amount, and then you don't have to pay any other additional fees for a service. Coinsurance is really looking at it in a percentage way. So your plans are set up so that once you hit your deductible, once you pay that first deductible, then you pay a portion and the plan pays a portion. That's coinsurance. You're going to pay 20%. The plan's going to pick up 80% until you hit an out-of-pocket max. And that's the last term. And the out-of-pocket max is kind of just what it says it is. It's the most you should have to pay out of your pocket. That out-of-pocket includes deductible, copays, and coinsurance. And when we look at the benefits, you'll see the out-of-pocket for the plans that you have. And I should clarify that the out-of-pocket, when we talk about your benefit schedule, we're talking about in-network benefits, meaning that you're using an in-network provider. If you're using out-of-network providers, then while you have deductible and coinsurance that applies, as well as an out-of-pocket limit for out-of-network, the rules are a little bit different in that you can have charges over and above the out-of-pocket limit, and that is due to the fact that they're not negotiated fees. So when you stay in-network, they're negotiated fees. So you have the Blue Cross national system throughout the United States. Those various Blue Cross by states are negotiating the rates with the providers. So as long as you stay within the network, you will have the out-of-pocket that we're talking about in the benefit schedule. So you have these two plans, the traditional PPO plan and a high deductible health plan. The deductible under your traditional plan is a $500 deductible, $1,000 maximum for the family. And then the high deductible has a $2,600 deductible per individual and then $5,200 family. Coinsurance between the two plans is also the same. It's 20%. So once you've hit your deductible or paid your deductible in the year, then you're going to pay 20% and the plan will pick up 80% until you reach your out-of-pocket limit, which is under the traditional plan is $1,500 per person, capped at $3,000 in a family unit, and the high deductible, it's $5,000 is your out-of-pocket, with $10,000 being the family max. You'll see that your preventive care, whether it's well child care or cancer screenings like a pap smear or a PSA test, those are going to be covered at 100%. You're not going to have to pay anything. On this next slide, you'll see that your traditional PPO plan has some things in red. Those are the changes that we have. So currently you have office visit with a $20 copay. Starting January of 17, your primary care visit will be a $25 copay and a specialty visit will be a $50 copay. And if you look at the note on the bottom of the slide, you will see that primary care is defined as general practice, family medicine, internal medicine, pediatric, OBGYN, psychiatry, and psychotherapy. These are all considered the primary care. If it's not one of these, then it's going to be a specialist and you'll have the $50 copay. Then you'll see with this plan, the traditional PPO plan, inpatient hospital, emergency room, and outpatient services, and a whole host of other services are going to be covered. Once you hit the deductible, once you pay that deductible in a calendar year, the plan is going to pay 80%. You are going to pay 20% until you hit your out-of-pocket maximum, that out-of-pocket limit. The prescriptions you'll see that you do have in red also, there is a change. Your generic stayed the same at $10 copay for a 30-day supply. you have a formulary brand or preferred brand, that's a $40 copay. It was $35 or is currently $35. In Jan 1, it'll go to $40. And the non-formulary or non-preferred brands is going to go from currently $60 to $75 starting January 1st. And then on your high deductible health plan, you see that really you have to pay your deductible first. Then you're going to pay 20% after the deductible has been met in a calendar year, and then it will go to 100% once you hit your out-of-pocket limit. So finding a provider, you do have, this is not changed, I should say, is you do have through the CFA Blue, who is your third-party administrator and also a division of Blue Cross Blue Shield of Virginia, and how you can actually go access. You can look at this information through your intranet site to find access. You've got the customer service line is listed on this slide, but that would also be on the back of your ID card. And just remember that your group number is SXP, the last bullet. As I mentioned earlier, your premiums are changing. Your traditional plan is going to see an increase in the premiums, while your high deductible health plan is going to see a decrease. These rates are being aligned more with the out-of-pocket that occurs. The employee actually, you have more liability under the high deductible plan, and so these are being lined up more based on the value of the plan. You will also see that the HSA monthly employer contribution, if you have the high deductible health plan, you will get the monthly contribution into the HSA account, into your HSA account, if you are eligible to have money put into an HSA. The next few slides are going to be scenarios to give you an idea of how you should set up and how you can make a decision about which plan is better for me. Should I do the traditional PPO plan, or does it make more sense for me to do that high deductible health plan and put money into an HSA? So the first scenario is a low healthcare user with single coverage. So Maggie is a single, healthy female who takes advantage of preventive care visits. In the year, she sees a doctor twice. She has a non-formulary brand prescription for Singular that costs $120 and is filled twice a year. So under the traditional plan, the first item that we're going to see here is the annual premium. And if we take that monthly premium on the prior slide and multiply that times 12, we'll get $1,713. Whereas the high deductible health plan, the calendar year annual premium is $954. Then we look at the office visits, and under the traditional plan, you're going to pay a $25 copay because those are primary care. So 25 times 2 visits is $50, whereas we're going to pay the cost of those, the full cost of those primary care visits, and we're making the assumption that they will be $150. So 150 times 2 is $300. The prescription drugs under the traditional plan, we have non-formulary brand prescriptions. There's 2 of them. Your non-formulary is going to a $75 copay times 2 is $150. And then on the prescriptions under the high deductible, you have to pay for those medications because you haven't met your deductible yet. So that's going to be $240. So then the total estimated cost, we take the traditional plan and we take the premium of $1,713 plus the $50 in the copays and the $150 for the prescription, and that gets us to $1,913. That's our total cost for that traditional plan. Versus the high deductible plan, we're going to add the $954 plus the $300 plus the $240 gets us $1,494. And now we get to take into account that SureScripts gave us money into our HSA account of $1,500. That $1,500 can be used towards qualified healthcare expenses, which include the office visits and the prescriptions. So $300 and the $240. So $540 is going to be taken out of my HSA. And you'll see at the very bottom, after I take out that $540 to pay those eligible expenses, I have an HSA balance still that I'm going to carry over of $960. And then when you look at the line above that, you'll see that my total cost is the premium plus medical services. And the medical services I paid with my HSA, so it's really $954 is the cost of that plan, plus now I have $960 to use for future eligible expenses. So that's scenario number one. Scenario number two is going to a single person who has is a high healthcare user. And so this individual, George, is a diabetic and has several prescriptions through the year. He knows he's going to have surgery in 2017, and due to the surgery that he's planning, he knows he's going to meet his out-of-pocket maximum. So we clearly know what our out-of-pocket maximum as long as we're using in-network providers. So our annual premiums are the same as they were on the prior slide. No change here, $1,713 versus $954. The out-of-pocket max on the traditional plan is $1,500 versus the high deductible plan is $5,000. And you know, we know on the prescription we met the out-of-pocket, so we don't have any more than $1,500. Same thing with that $5,000 when we've hit that number. So the total estimated cost is $3,213 for the traditional plan, and then $5,954 for that high deductible plan. And then we get to take into account the $1,500 that SureScripts put into my HSA. That $1,500 can go towards paying that out-of-pocket max of $5,000, but I'm still going to have to pay $3,500, which is, you know, the medical cost after the HSA contribution from SureScripts. So my total cost for that plan is $4,454. So you can see if you're going to maximize the plan, taking that traditional PPO plan is probably your better bet. Then scenario number three is a family, and families are a lot more complicated. Obviously, you've got multiple people that we're working with. I've taken, you know, pretty simplistic view of charges so that we could just see what the amounts end up in the buckets. But obviously, anybody who has family coverage is really going to need to take a look at everybody in the family. And the best way to look at it is how you've used services this year and how you used services last year. And you can pull explanation of benefits from your health plan in order to help you work through that process. But Justin has two kids, under the age of 6, and a spouse covered under the plan during the year. There are 15 visits to the doctor, and of those 15 visits, 10 are primary care, 5 of them are preventive. 2 prescriptions per month with all the family members. Half of them are generic and half of them are preferred brand, and the total cost of those meds are $1,500 under the high deductible plan. So premiums are a little bit different under the family. You can see it's a lot more coming out of my paycheck. So the traditional plan is $5,147 versus the high deductible plan is $2,204. The office visits, I have 10 office visits. 5 are preventive, so they're going to be covered at 100%. So 10 times $25 copay is $250. And then I'm assuming $150 per visit, so 10 times $150 is $1,500. I have prescription drugs at $600, so I have 12 copays at the generic and 12 at the preferred brand, and it equals $600. Versus under the high deductible plan, I'm going to pay the cost of those meds at $1,500. So my total estimated, the 2 plans, $5,994 for the traditional plan, $5,204 for the high deductible plan. And then SureScripts is going to put money into my HSA account. On a family plan, it's $2,400. I can use that $2,400 towards my office visits and prescriptions. And you'll see that if I add the office visits and prescriptions, that's $300 minus the $2,400 I'll use out of my HSA. I'm still going to owe $600. So I'm going to have $600 towards my medical expenses, plus then I still have my premium. 600 plus 2204 gets me to 2804. So as you look at this, you can see that that lower premium on family coverage, in this particular instance, the high deductible is an advantageous plan to select. But again, as I mentioned, everybody's situation is different, and you really need to do the numbers for your own situation to figure out what works best for you. Now we're going to spend a little bit of time in the health savings account, and as I mentioned earlier, Wells Fargo is no longer going to be doing the health savings account. They sold that business to Optum, and so your program is going to move over to Optum effective January 1st, 2017. So here's the agenda, but I'm going to move right into the information. So Optum is owned by United Health Group. It's been established. It was established in 2003. And then the one thing that is nice to know about the Optum Bank is that your deposits are insured up to $250,000 FDIC. And they're one of the leading providers of health savings account, and they administer over 2 million individual health savings accounts. So they do have quite a bit of business. They know what they're doing. The health savings account are designed to help you save and pay for qualified healthcare expenses. You deposit money into your HSA and you save on taxes. And you use the money in your HSA for qualified healthcare expenses and on a tax-free basis. And you can invest your savings in mutual funds, which will earn tax-free also. You do have to have a qualifying high-deductible health plan in order to put money into an HSA. You use the dollars in your HSA for qualified healthcare expenses. It's funded by you or your employer, or others. So you could have somebody else putting money into your account, which would be a great thing. And the account funds belong to you. So you're going to be, well, those of you who have one already, you have an account. It is in your name. It is your account. The money, as soon as it goes into the account, belongs to you. It grows over time and can be invested. So the investments are not FDIC insured, and that is not unusual. That is pretty much how investments work. So you're in charge of managing your HSA account. The annual contribution limits are set by the IRS. Deposits can be made at any time and are available immediately as soon as the money goes into the account. You have access to the money. All the deposits up to the annual IRS limit are income tax free, and withdrawals made for qualified healthcare expenses are not subject to the income tax. So not everybody can open up an HSA just because you have a high deductible health plan. You're eligible to open up and contribute to an HSA if you're covered by the qualified high deductible plan. You are not covered by another health plan that is not a high deductible plan. You cannot be enrolled in Medicare, TRICARE, or TRICARE for Life. You cannot be claimed as a dependent on somebody else's tax return. You're not covered by a healthcare flexible spending account. For an example, you have a spouse that works, and if your spouse is enrolled in the medical reimbursement account at her work, that's considered another health plan that would make you ineligible to make deposits into your HSA. And then you cannot have received veterans benefits within the past 3 months except for preventive care. So contribution, the IRS determines how much can go into the account. In 2016, it's $3,350, and that's going to go to $3,400 in 2017. The family coverage level is $6,750, and that is not changing for 2017. And individuals who have coverage other than single are considered family coverage by the IRS. So the employee plus spouse, employee plus children, coverage levels under SureScripts would be at $6,750 cap. If you're age 55 and older, you can put an additional $1,000 into your HSA. So HSA helps you save. The money Steve puts into his HSA is income tax deductible. Any money he withdraws from the HSA to pay for qualified health care expenses is income tax free. He can earn interest on his account, and it's not taxable. And the amount not spent during this year carries over for use in future years. And this goes on to talk about how much money Steve actually put into the account, and then he earns income in that account and interest, and he doesn't have to pay income taxes on that interest, and that anything that he carries over are his dollars. And that is really what we've been talking about. So use your HSA funds now or save in the future. So there are some people who build up the balance in their HSAs if they can afford to pay for their medical expenses and plan to use their HSA in retirement years. So you certainly can do that. HSA qualified health care expenses include what you would expect, medical plan deductibles and coinsurance. So anything that gets applied to deductible or you paid your 20% on, that is going to be an eligible expense for the for the HSA. In addition, dental and vision care services are also eligible expenses. So your vision, if you've got the vision plan and the allowance, it'll pay $130 towards your glasses, but your glasses are $300. The difference you would be able to take out of your health savings account as an eligible expense. Same thing with dental, those expenses. So it's just similar to the list that you would use for the medical reimbursement account under a flexible spending account. And then you can use your HSA dollars to pay for qualified healthcare expenses for your spouse or dependents that are considered tax dependents. Other HSA qualified healthcare expenses include health coverage while you're receiving unemployment benefits, COBRA continuation coverage, premium for that, premium for qualified long-term care policies, and then Medicare premiums and out-of-pocket expenses. So paying for non-qualified expenses, yes, you can take money out of your HSA to purchase the TV, the big screen TV. You will pay your taxable rate in the year that you took the money out, plus a 20% penalty. The 20% penalty does not apply once you turn age 65 and older. How do you make deposits into your HSA? Payroll deduction is the most cost efficient, and that's because you not only get state and federal tax savings, you also get the FICA taxes. You can do contributions online from your bank account, for an example, from another institution into your HSA account, just like you can with other bank accounts. Or you could mail a check, deposit additional dollars into your account by mailing in a check. And then you can make deposits up until April 15th of the following year and still get the tax savings. So if you're doing contributions through payroll deduction, you get the tax savings immediately. But if you do an online contribution or mail a check, you would do your individual income tax. You would get the savings, the tax savings there. You would get your federal and state, but not your FICA. You do have the eligibility or the possibility of a rollover from an IRA and medical savings account or another HSA. So you can do a one-time distribution from a traditional or Roth IRA, cannot exceed your contribution eligibility. You can also roll over from a medical savings account, although we don't see too many of those, so it would be kind of a rare situation. And then obviously you can transfer from another HSA into this HSA. So if you were at a prior employer that had a high deductible with the HSA and you have a balance running in that health savings account, you likely are paying some kind of an admin fee on a monthly basis. If that's the case, you would likely want to roll over your HSA account into the one that you have with SureScripts, because SureScripts would be paying that admin fee on your behalf while you're an employee. Accessing your HSA funds, you will have a debit MasterCard issued to you from Optum Bank. You can do automatic bill pay or online banking just like you can do today. You can get HSA checks. You can get checks for the account. And then you can also pay for an expense with personal funds and then reimburse yourself from your HSA. So saving your receipts is important because if you get audited, the IRS is going to come after you about qualified expenses. So under a flexible spending account, it is the job of the administrator to make sure that those are eligible expenses. So they do send questions about substantiating expenses. Under the HSA, that is not the case. You can access those dollars in your HSA account anytime you want. They don't ask you for receipts. You will, at the end of the year, put on your individual income tax how much money you took out of the HSA account, and then it's going to ask you a question about how many of those dollars were considered eligible expense for qualified healthcare expenses, and then you're going to put a dollar amount in there. If you get audited by the IRS, then they are going to ask you to substantiate. So my recommendation is that you keep like explanation of benefits, and receipts that would substantiate your HSA, uh, not deposits, but withdrawals, and keep that with your taxes on an annual basis. So how Molly uses her HSA, she goes to the doctor with a high deductible health plan. She presents her ID card at the doctor's office. The doctor is going to submit that claim to the health plan because the negotiated fees need to be recorded, an explanation of benefits issued. Molly is going to fill a prescription, and in order for her to get her prescription at the pharmacy, she's got to pay for it. If she's got the money in her HSA account, she can use her debit MasterCard to pay for those prescriptions. And then when Molly gets her doctor's bill that says that she owes X amount, she can use her debit card to pay for that. And then obviously she's going to want to keep receipts. So managing your HSA online, this looks a lot like a lot of other online tools that we have. You'll have that through Optum too, so that you can look at your balance and you can see the deposits and withdrawals on there. There are calculators available. You can see your year-to-date contributions. And then you can manage your investment activities on this account. Once you hit $2,000 in your account, anything over $2,000, then you can invest. And then here's a little bit more information about the investments. Obviously, you'll have different funds that you can choose from. And then as a new account holder, and you will be a new account holder with Optum, you will receive a welcome kit. You will get your debit card. It will be in a separate mailing. Just remember not to throw away what you think is junk mail, because you will have a card in there, so be watching for it. Once you have that, you'll be able to log into your account with Optum for the first time so that you can set up your online access. And then here's some customer service information. You will, right now they won't know who you are from SureScripts. That all is happening right now. So if you have questions about the health savings account, I would direct those to Lisa or to me. We can get answers for you. And then once you will be getting some communication directly from Optum in regard to the transition for those of you who already have an account, and there will be customer service numbers on there. The dental plan, as I mentioned earlier, there are no changes with this particular plan in regard to the benefit or to the carrier. So you are with Delta Dental. You have the nationwide provider network. You have Delta Premier, which is the very large network, and then Delta PPO, which is a much smaller network. And the smaller network just has bigger discounts available. But it does encompass 75% of all dentists nationwide. You can go look at these providers, either the Delta PPO or the Delta Premier, and obviously using in-network providers are going to save you because you won't have the balance billing. If you go out of network, it is going to be based on usual and customary in a given zip code area. So you just want to be careful about that and understand what those member liability might be. In regard to your benefit plan, no changes. You do have in-network and out-of-network. You'll see that you have the same deductible. You have preventive available to you without the deductible being applied. You do have an annual benefit of $1,500, so that's the max benefit plan will pay out for services. Basic services like a filling would be covered at 80% after the $50 has been met. That's an annual or calendar year deductible. The major services like a crown would be covered at 50%. And there is orthodontia benefits available, lifetime of $1,000 for dependent children. Delta has online tools on the customer service. You can go to deltadentalmn.org. And if you've got the online tools, you can go sign up and order ID cards for yourself. You want to look at explanation of benefits, you can do that. And then customer service, the numbers are here. You should have those also on the back of your ID card. And then the premiums on this particular plan are going to increase. As you can see, the single employee only is going from $9.24 to $10.14, $18.44 for the employee plus one to $20.23, and then family is $31.86 to $34.96. Your dental plan is self-funded, so you pay a small administrative fee to Delta Dental. for processing claims and access to the network, but the majority of the cost of the plan is in regard to claims utilization. So due to the fact that there was an increase in the utilization, there is an increase to the rates this year. Your vision plan, no change here. You still have vision service provider, VSP. It is paid 100% by you. The benefits have not changed. Your preventive exam is a $10 copay you can get once every 12 months. You can get standard lenses with a $25 copay every 12 months. You can also get contact lenses up to $130. You can get either the lenses for glasses or contact lenses once every 12 months, but not both. And then frames, you have a $130 allowance after a $25 copay. That's available once every 24 months. And then you have discounted services for laser, correction surgery, and second pair of glasses. No change to these premiums. You'll see them here. $879 for an employee only, $1342, and then $2407. Life and disability, there's really no change here either. Your carrier's Cigna, that is not changing. This life, term life and accidental death is 100% employer paid. You get 2 times your annual salary to a maximum of $500,000, and that is in the term life and the accidental death. If you have an updated beneficiary, know who your beneficiaries are, you want to check that. So the way the benefit works is that if I die from cancer, my beneficiary receive 2 times my salary. So let's say I make $50,000. So my beneficiaries receive $100,000. If I die in a car accident, my beneficiaries would receive $200,000. You have an opportunity to purchase additional life and accidental death. This is 100% paid by you on a post-tax basis. Employee can purchase up to $10,000 increments, spouse is $5,000 increments, and child is $1,000 increments up to $10,000. There is really no true open enrollment at this time of the year. You have a one-time eligibility when you're a new hire, and then after that you have to fill out a couple of health questions, and Cigna gets to decide whether you're approved or not. And then voluntary AD&D is the one times voluntary life election. So it goes along with the life. The disability, this is short-term and long-term disability, is also covered through Cigna, employer paid on your behalf. So short-term is 60% of your weekly earnings up to a $4,000 weekly max. There is a 15-day wait before you can start collecting, and you can collect for up to 11 weeks. And then once you get through with that, you can go to the long-term disability, which is a 60% benefit up to $15,000 monthly. You do wait 90 days before you can collect on it. It has a 2-year own occupation, meaning if you're disabled from your own occupation, you would collect for 2 years. After that, it's disability based on any occupation, and not just any occupation, but one that you're similarly there's some specific words about in the same kind of a income that you would be bringing in. So there is coverage up until you get to Social Security normal retirement age. Flexible spending accounts, you have Alaris as your flexible spending account administrator, not a change. You can elect, and you'll see here it says $2,500, and actually it's $2,600. The IRS just recently announced that it can go to $2,600 as a qualified max for the health care plan. If you do elect to have anything taken out of your paycheck, you would have access to the dollars first day of the plan year, so January 1st. You have to incur the expense during the calendar year, January 1 through December 31st, and then you have to file a claim no later than March 31st following the end of the plan year. Any unused money is forfeited, so it goes back to the plan. If you are in the high deductible health plan and contributing to the HSA, you could also make an election, but it would be limited to dental and vision expenses only. Dependent care, again, administered through Alaris, you can elect up to $5,000. It is a January through December plan year. Again, 90 days to make claim. unused money is forfeited. The difference with this plan is that you access the money after it comes out of your paycheck. So you have to have it deducted first before you can access the dollars. The transportation plan, again, this is through Alaris. It operates differently, and I apologize. Each one of these has a little bit different set of rules. You can do a monthly election that you can change throughout the year. You can elect up to $255 a month for parking and or $255 for transit. You access it through a Visa debit card, and then you don't need to actually forfeit any money because it rolls over from year to year. So this plan works very differently. You'll have a Benny card that comes with your Flex account. It also has a mobile application that you can use. And then you have 24/7 web portal. You can view balance, file claims through actually the phone app, etc. So lots of resources available through the Flex account administrator. You also have legal and identity theft protection on a voluntary basis. You can purchase the policy. The Legal Shield gives you ability to talk to an attorney on any matter for one flat monthly fee. So a lot of people will purchase this when they need to do their will and then maybe drop it the following year. But obviously, a really nice benefit program to have at group rates. The identity theft is a separate plan. You can buy either the Legal Shield and identity together or separate. And obviously, this will provide protection for you on the identity side. Covers you, the member, or you can purchase it for additional family members too. No change to these premiums. You can see that there's a combo price for this also. And retirement, I think I'm going to hand this off to somebody right now.
Rob,
Yep,
are you there?
this is Rob. Can you hear
There
me?
you go.
All right.
We can hear you.
Good. Well, I just wanted to take a minute. First of all, Larry and I, we're your 401k guys. This benefits package that SureScripts has put together, we sit through a lot of these presentations in person and online, and this benefits package is incredible compared to what we see out in the marketplace. So as part of that, along with all these other benefits, you have your 401k plan, and what Karen and Lisa and Caroline wanted us to do is go out in the marketplace and shop your plan and do a request for proposal to see if there are better options out there. And there was. We went through a process. We went out to all the vendors, looked at pricing and features, and so the 401k plan record keeping and administration will switch to Fidelity in April of 2017. Some of the reasons for that were reduction in fees, about a 40% reduction in fees that you'll pay. Fidelity has the best technology out there as far as web, mobile, and financial planning tools. So we think you're really going to like the new platform. There's not a ton of detailed information we can send out at the moment, but over the next couple months, you will be getting a lot of communications. We will do training sessions on the new website, and we think you're really going to like it. So just basically stay tuned for more information coming on this stuff. So thank you.
Thank you. Moving into work-life benefits, just a few reminders that you've got Cigna Life Assistance Program, guidance or referrals for services in your community. So you have some place you can reach out to that's going to do the legwork for you. So just remember that you've got this available to you for all these different things here: parenting, senior care, child care, pet care, temporary backup. So remember that you've got this available. You also have a secure travel through Cigna. So protects you when you travel domestically or internationally, as long as you're 100 miles or more away from home on company business or on vacation. It could be emergency assistance, general assistance, pre-trip planning, assistance making emergency travel, assistance with lost or stolen items. A good example is for those of us who wear glasses, if you happen to have an incident where they break, you can use your secure travel to get your prescription at your doctor's office and help you find a place to actually get them redone so that you can see to get yourself back home again. So the secure travel is something that employees all have available to them 100 miles or more away from home. You also have a pet insurance through veterinary pet insurance at a group discounted price. You can go to thepetinsurance.com/surescripts, or you can call 800-PETS-BPI to get more information if you're interested. You also have available Wells Fargo at Work, which is through the banking program. You have some preferential treatment in regard to banking accounts that you could set up. Also, there are education programs that Wells Fargo at Works, and then you get interest rate discounts. So if you're interested, here's a phone number you can call, the 800-WFB-OPEN, or you can stop at a Wells Fargo store, bank, and just mention that you are part of the Wells Fargo at Work program through SureScripts. You also have discount websites through LifeMart and Working Advantage. So these particular websites are, I think, familiar to most people. They give you discounts in lots of different products. You can see the theme parks, vacation packages, gifts, and retail shopping. Access the LifeMart through your ADP self-service under My Tools under End Life Care link. And then the Working Advantage is by visiting the www.workingadvantage.com. These should be also under your Connect, I believe. Also, SureScripts has available for you cell phone discounts. So if you've already got coverage through Sprint or Verizon Wireless and you haven't already tried to take advantage of these, I would tell you to make a call and let them know, because you'll get these instantly on your next bill. You'll see these discounts. And then I'm going to hand it over to Lisa about your corporate athlete 2017 highlights.
Thank you, Lori. So for the corporate athlete in 2017, we are going to continue with a Fitbit Step Challenge just as we did in 2016. The difference is this year this coming year, 2017, we will be walking the United States, and we will be doing monthly prize winners instead of doing one annual prize winner. We will also have the opportunity to sign up for daily affirmations, and we plan on bringing some relaxation to your employee break rooms with some waterfall machines, soothing music, some plants, to kind of make it more of a relaxing environment. We are also, Lori, if you could, there we go, thank you. We are also going to have in the third quarter mini mental capacity scavenger hunts. I will have a day that we will bring on-site massage therapists so you can come by and get free massages done. We will continue to provide online seminars and how-to videos, and we will continue to post articles, videos, and other informational items on the corporate athlete page, which is located on Connect. And in case you are not familiar or you may have forgotten where to access that, you can go to your My SureScripts drop-down, and under the Employee Wellness section, there is a link to become a corporate athlete. And our next section, this is just a list. The next two slides is a list of employee benefits and perks that we really don't get the opportunity to go over in detail during new hire orientation or throughout the year. So we wanted to bring these out to your attention during open enrollment. Some things that you may not be aware of, such as our 24/7 nurse line triage services that comes with our medical plan. We do get a health rewards program that offers discounts on a variety of programs and services under CFA Blue 365. We also have, Lori had mentioned a secure travel with Cigna. We do have other items that are free with Cigna as part of a package. For example, we have free will preparation services. In addition, we do have assistance for our beneficiaries if something were to happen to us. They have a service that our beneficiaries can use to assist them with matters during those times. So this information, the PowerPoint will be provided on Connect under the open enrollment information after today. So you'll be able to access this there for, you can read additional into that as well. The healthcare reform for 2017, Lori and I are going to kind of piggyback on this one. One thing I want to bring up is the 1095C forms from last year. We had a lot of them that came back as incorrect. ADP manually reviewed the forms and 111 of them were updated. And last week I mailed them out. I submitted them in the mail, so a new form should have been sent to your attention. You should be getting them this week. Hopefully they would be correct. Please notify me if they are not, and you can shred your old documents, any ones that are incorrect. You will not need to provide this form. Only if you are audited will you ever need to provide this. And so, Lori, did you want to touch on that, the cost for that?
Yeah, so one thing I just wanted to go over very quickly is the healthcare reform for 2017 under the individual mandate. So just note when you do your 2016 taxes, you're going to have to, again, answer that question. If you did not have health insurance or anybody in your household didn't have insurance, the penalty for 2016 is $695 per adult, or 2.5% of your income, whichever is greater. That's what you're going to use. Now, I think for SureScripts employees, anybody who's working 30 or more hours a week certainly is going to have the plan. I think you are all hearing information in the news media around the 2017 exchange enrollment and hearing things like increased premiums, significant increased premiums, and how individuals are going to have less choice, higher costs. So just some things from my perspective is that for individuals who are on the lower income on income scales, they're going to actually see higher subsidies. So some individuals, even though we are seeing increases throughout those exchanges in the premiums, many people won't actually see those increases because the subsidies will increase. But certainly we will have a number of people that will have those increases, and it's going to be much more difficult. In states like Minnesota, the carriers that are offering coverage here are doing some unique things in regard to limiting the marketplace and also, well, limiting the number of policies they're selling, as well as using very narrow networks. So individuals that might have wanted to use Mayo Clinic wouldn't necessarily be able to have those as in-network providers, which is causing some strife. So people should be paying attention super early. November 1st, actually tomorrow, is open enrollment on the exchanges. So if you have family or friends that are looking at the individual marketplace, they want to do so sooner than later. And then next steps, hand that right back to you, Lisa.
Sure thing. So the next steps of what everyone is going to do. Open enrollment begins on Wednesday, November the 2nd, and it goes through Friday, November the 18th. There are no exceptions that will be made outside of this time frame. This is your time to make changes to your benefits without supporting documentation needed. There's no life event required. Last year, we had everyone do a full enrollment. This year, that will not be necessary. You only need to go into ADP and make changes or to enroll if you are adding or removing dependents or a spouse, if you are changing your health plan, or if you're dropping a plan or a benefit. If you're not doing any of those, you don't need to go in. If you are enrolling again in an FSA account or an HSA account, you do have to go in and re-enroll in those. That is an IRS requirement. That is not something that we can allow just to roll over as it is from last year. So an HSA and an FSA, you must go in and re-enroll. If you have the unlimited Metro Pass, you do not need to re-enroll in that. You can just leave that as it is. It will continue to go forth as normal. All changes will be made, will take effect on January 1. You'll see the changes come out on your January 15th paycheck. So we will announce on Wednesday when you are good to go to begin your open enrollment. The upgrade for ADP did not take place, so you will use your normal portal link that you have been to make the changes. Everything will be available online. We are exactly at our stopping point. However, we do have some time because we did start a few minutes late for some questions. If you could please type them up in the box for me. Lori, I do have some questions I was not able to address. One of them was regarding HSA, and they wanted to confirm if your husband has an HSA, you cannot contribute to one here if you are on his plan. Is that correct?
No, that's not correct. If your husband has a qualified high deductible health plan and because of that qualified high deductible health plan is putting money into an HSA, that's not going to keep you from putting money in your plan. It's only if your husband's or health plan is something other than a qualified high deductible plan.
So if he had a PPO plan.
Right, a copay plan, anything that's not considered a qualified plan.
Got it. Are there more questions? Please feel free to type them in the chat box. It's easier for us to answer them using the chat box than to unmute everyone due to the noise. We'll give it a minute or two for questions. Okay, if we do not have any further questions, we will go ahead and we will end today's session. If you do have questions, though, throughout the enrollment process, open enrollment, feel free to reach out to me or to Karen in Human Resources. We are more than happy to address any questions or concerns throughout this time period. And please use your resources on Connect. And thank you very much for attending today. And Lori, thank you very much for presenting to us.
You're very welcome. Have a great day.
Thank you.
Bye.
Take care.